This study is called the Heme study and is being led by Dr. Jennifer Huberty at the University of Texas San Antonio Mays Cancer Center and Dr. Ruben Mesa at the Wake Forest Baptist Comprehensive Cancer Center. The goal of this study is to test how an 8-week app-based wellness intervention can impact sleep behaviors and immune function among people living with a hematological cancer diagnosis. This is a remote study that is being conducted across the United States and is approximately 5 months, or 21 weeks, in duration. For this study, we are looking for US-based, English-speaking adults over 18 years of age who have been diagnosed with a hematological or blood cancer and who have poor sleep. Eligible participants will provide informed consent online, and then will be mailed a sleep device that will be worn on the index finger and asked to provide a small blood sample at a lab close to them. Once participants receive their sleep device, they will be invited to a 30-minute virtual introduction session with a member of the research team to review the study procedures. Following the intro session, participants will be asked to complete an online survey. Then, for 1 week, participants will wear the sleep device on their index finger and keep track of their sleep habits in a brief daily sleep survey that will be sent to them via email or text each day. At the end of the 1-week period, participants may be invited to continue on to the 8-week app-based intervention period. During this 8-week period, participants will have access to one of 2 smartphone-based wellness apps and be asked to use the app at least 10 minutes each day for 8 weeks. Participants will also be asked to wear the sleep device daily and complete daily surveys about their nightly sleep for the entire 8-week intervention period. At the end of each week, there will be 1 additional brief survey sent to ask about any changes in treatment or sleep habits, as well as feedback on the experience of using the app. At the end of the 8-week period, participants will be asked to complete another online survey and provide a second blood sample. They are then welcome to continue using the wellness app if they desire, but are not required to continue daily sleep monitoring with the sleep device or surveys for the next 11 weeks. Approximately 2.5 months after completing the 8-week intervention period, at week 21, participants will be asked to complete 1 final online survey, provide a third and final blood sample, and then participate in 1 final week of wearing the sleep device and completing daily surveys about their nightly sleep. The sleep device will then be returned to the research team. Compensation will be provided at the end of each of the 3 checkpoints in the study in the form of an Amazon e-gift card. Participants who complete all aspects of this study can earn compensation in the amount of up to $100. Additionally, participants who complete at least 80% of the daily sleep surveys will be entered to win a raffle for one of 3 $100 Amazon e-gift cards. Overall, this study has been described as quite intensive and does require a strong commitment to complete these tasks over the study period. We want to be sure you are aware of the time commitment before we move forward. This study is also not intended to replace any treatment recommendations or advice of your care team. Does this sound like something you might be interested in participating in?